Well, we often associate the flu with a cough, sore throat, body aches, and tiredness. But did you know the flu can also increase your chances of having a heart attack?
In this morning's Focus on Your Health, Teresa Snow looks at the connection and what you can do to lower your risk.
Focus on Your Health is sponsored by MU Healthcare.
Joining me now is Dr. Brian Bostick, a general cardiologist here at MU Healthcare. Tell me more about the connection between the flu and heart attacks and strokes. This can be a dangerous time of year.
It is a dangerous time of year. The flu puts increased stress on your body, particularly your heart, and causes an increased risk for heart attacks and strokes.
Tell me about the other risk factors for heart attack and stroke. What do we need to be watching?
Smoking is still a major preventable risk factor that's high in Missouri. Also, high blood pressure, high cholesterol, diabetes, and kidney disease are major risk factors for heart disease.
Tell me about high blood pressure. Those numbers have changed of when we need to be concerned about our blood pressure.
They have. So in 2017, we at the American Heart Association put out new guidelines that lowered the threshold for diagnosing high blood pressure to a blood pressure of 130/80 being the threshold where you have high blood pressure, where previously it was 140/90.
Does that mean more people need to be taking blood pressure medicines, or more people need to be just engaging in the process of looking at what should they do?
More people engaging in the process. So these new guidelines are about prevention, and we want to identify people earlier to let them know that they have high blood pressure. This is a problem. Most of the patients who are newly diagnosed with these new guidelines won't require medications. It's diet and lifestyle changes. Move more, eat better, decrease your healthy weight.
We know that. We know we should eat better and get moving more. It's hard probably to get people's attention, but there are some statistics that are pretty grim.
There are. So the newest statistics that were released just in this new year show that for the first time in about a decade, the rate of heart attack and stroke actually went up in the United States.
Do you think we're diagnosing it more? We are more lazy about managing our risk factors? What do you think is leading to that?
So the increased rates of obesity, we still do have a number of patients. We have a high rate of smoking still. So it's those preventable risk factors. And that's why early diagnosis, early prevention, everybody going to get your risk factors assessed, we can really improve our health in the long term.
Now, we have a team of specialists here at MU Healthcare. A lot of folks will start with their primary care physician. Tell me how you work together with managing heart disease.
So we work with primary care doctors very closely, and they'll send us their patients who've just had really difficult to control blood pressure or cholesterol and need our multidisciplinary team to look at new medications, therapies, or complex interventions. But I also see a lot of patients who come straight to me because they have a strong family history of heart disease or a lot of risk factors, and they're just very concerned. So anyone, has access to come and see us at any time to get that taken care of.
If you got on your soapbox and you said, I just want people to know one thing about heart disease, what would it be?
Move more. Move more, eat better.
Two things, we'll take them. Thank you very much, Dr. Brian Bostick. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU